Narration. Before using Salonpas Topical Patch Dermatological Irritants-Counter-Irritant Formulations, it's important to consult your pharmacist for guidance. This medication is used to relieve minor aches and pains on the muscles and joints. It is recommended to apply the patch to the affected area no more than 3 to 4 times a day. It's best to apply the patch during the daytime, and it should not be used on broken or irritated skin. Ask your pharmacist or doctor for more information. If you experience any side effects from using Salonpas Topical Patch Dermatological Irritants-Counter-Irritant Formulations, it's important to consult your pharmacist or physician. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Ask your pharmacist or doctor for more information. It's important to consult with your pharmacist or physician before using Salonpas Topical Patch Dermatological Irritants-Counter-Irritant Formulations. Make sure to keep a list of all your medications and share it with your doctor and pharmacist. This will help them understand any potential interactions with other medications you may be taking. If you suspect an overdose and see someone passing out or having trouble breathing, call 911 immediately. Otherwise, contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, contact your provincial poison control center. It's important to act quickly in case of an overdose or serious symptoms. Currently, there is no official document providing detailed information about the Salonpas Topical Patch Dermatological Irritants-Counter-Irritant Formulations. Ask your pharmacist or doctor for more information. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.